Diabetes mellitus, what you need to know for your medical school exams. Diabetes mellitus is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. Diabetes is classified into 3 types: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune disorder where the body's immune system attacks the insulin-producing cells in the pancreas, leading to an insulin deficiency. Type 2 diabetes is characterized by insulin resistance and impaired insulin secretion. Gestational diabetes is a form of diabetes that develops during pregnancy and can increase the risk of complications for both the pregnant person and the fetus. Diabetes mellitus can be diagnosed through blood tests that measure the fasting blood glucose levels, random blood glucose levels, or the hemoglobin A1C levels. The management of diabetes mellitus involves lifestyle changes, including dietary modifications, physical activity, and medication. In type 1 diabetes, insulin therapy is necessary to maintain glucose levels. In type 2 diabetes, medications such as metformin can be prescribed to improve insulin sensitivity and control blood glucose levels. Complications of diabetes mellitus include cardiovascular disease, kidney disease, retinopathy, and neuropathy. It's really important to remember the complications of diabetes because this comes up in medical exams all the time.